No fewer than 5,000 adults and the elderly have benefited from the medical outreach organized by Glorious Liberty Church as part of activities to give back to society. The medical outreach, which was said to be part of God's commandment to the church, held on Sunday at the church premises for members and non-members, featured free medical consultations, blood pressure checks, blood sugar screening, and eye tests, among others. Speaking with Newsmen, GLC Global Pastor Richard Osanaye stated that the initiative was to follow the instruction given in the Holy Bible to give to the poor, adding that the economy of Nigeria and the situation also warranted the move, because it was observed that many people are going through a tough time, especially in healthcare and food. He disclosed that he was inspired by God to do the free outreach, adding that it is not the first time doing such in the church for members and non-members.
We have been instructed by the scriptures to give to the poor. Bible says, "He that gives to the poor lends to the Lord." And because of the situation of things and the economy of Nigeria, we realize that a lot of people are going through difficult time, particularly when it comes to healthcare and food. So we plan to have more than 5,000 this time. And but the idea, the way we did it the last time, it was too crowded. So this time we put a structure in place in such a way that you won't see a crowd, but you see a lot of people picking their stores. But we plan for more than 5,000 people, both for medical and for food.
Osanaye further explained that the target beneficiaries are over 5,000, lamenting that many people are dealing with diabetes and high blood pressure among the elderly without having the knowledge, according to data collated from the test. He appealed to the government to prioritize healthcare for its citizens, noting that the health insurance scheme should be made accessible for citizens and that the system should work for all. He also called on the church to ensure they play their part to address the issue of moral decadence, using the opportunity of the high rates of churches in the country, while also calling on political leaders to focus on the development of the country and address the major challenges. On his part, a medical practitioner, Dr. Busayo Shoremilekun, stated that the major health challenges among the beneficiaries are high blood pressure, particularly among the elderly, and diabetes. He emphasized the need for the government to improve on the nation's hospital infrastructure and equipment across the country.
We have nations where healthcare is almost free for their citizens, but it is not free for everybody. Like if you in the UK now, if you don't have health insurance, it's a big one, and health insurance is a lot of money. But for their citizens, it may be free. But what you call free is actually taken from somewhere to subsidize for others. You know, by the time the proper system is put in place, where there is resources and government can take this thing seriously, I think our advice to the government is to just take people's health seriously, because we have a lot of people with health issues.
The government needs to do more in infrastructural development and equipping our hospitals, the state hospitals, the local government hospitals, and at the federal level too. We need more hands to be on deck. We need more people to understand that health is wealth. Without health, we really cannot do much of our daily activities and perform our job as it were. So the government needs to do more in terms of infrastructure development.
Rukaya Sanusi reporting from News Network, Abeokuta.